Hello, my friends. Today we will discuss the idiopathic pulmonary fibrosis. My name is Sameh Mikhail and I am a pathology resident. This is your Pathway channel. Please like and subscribe. As we mentioned, today the idiopathic pulmonary fibrosis is defined as clinico-pathologic syndrome with marked progressive interstitial pulmonary fibrosis and respiratory failure. It has a radiologic pattern and a histologic pattern. The histologic pattern is referred to usual interstitial pneumonia. The pathogenesis is, as per the name, it's idiopathic. It may be environmental factors, and the most important among these is the cigarette smoking, which increases the risk of idiopathic pulmonary fibrosis several folds. And we have the genetic factors with some mutations. And for the microscopic picture that we will see in a few minutes, it affects mainly the subpleural areas, and along the interlobular septa, we will find marked fibrosis. The hallmark is patchy interstitial fibrosis. So it differs. You may find early lesions contain fibroblasts, and the late lesions will be the fibrocytes. It is characterized also on the gross appearance and the microscopic appearance with the honeycomb fibrosis, with the hyperplastic type 2 pneumocytes lining the cystic dilatations that we will see. We may also see mild to moderate inflammatory areas, mostly lymphocytes. Thank you so much for watching the video. Please like and subscribe. Hello, my friends. This slide is for the idiopathic pulmonary fibrosis. And as we mentioned on the PowerPoint presentation, that the histologic pattern of idiopathic pulmonary fibrosis is the usual interstitial pneumonia. So this is the lung parenchymal tissue, and this is from the lower lung lobes. Now we are moving towards the subpleural areas where we can find the main pathology as per the definition of the usual interstitial pneumonia. These subpleural areas, as we can see, they are remodeled and they are replaced by this cystic dilatations from this section. These are all cysts, and they are not, of course, functioning. And in between we can find the stromal fibromuscular proliferation that happened. These cysts, they are lined by columnar or low columnar epithelium, which we will see on the high power. And from this low power, just notice the architecture of the lung parenchyma, how it's remodeled with these all cysts. This is a big cyst, as we can see here, and we'll see it with the high power. Another, it's full of cystic dilatation. This is the subpleural lung parenchyma. These are all cystic dilatations, and we call them the honeycomb appearance. This is another cyst with the lining epithelium. This is blood vessel. And please notice also, I hope you can appreciate this massive fibrosis that is in between these cysts. This is the lining which we will see on high power. Let's move around. This is a big cyst again. And of course, this is all non-functioning. Here we can see also infiltrate with lymphocytic infiltration, which is common in the usual interstitial pneumonia. We have another focus here, and this is the lung parenchyma, that it's still not replaced by this massive fibrosis, though you will find some thickening of the septa. Now we are moving again towards the subpleural area. This is the high power of the same slide, And I just want to show you the lining of these cysts. It's all lined by this columnar or cuboidal epithelium and this massive fibrosis or fibrocytes that we can see. And in the usual interstitial pneumonia also you can see fibroblasts. It's not shown on this slide, but you can find scattered foci of fibroblasts. Now this is again the subpleural area. We can see here anthracosis, which can happen in, we find in many lung sections, or we call it the anthracotic laden macrophages, surrounded by blood vessels, and these are other cystic dilatations. For this section, I'll just stop here a bit. If you saw this section without moving the slide, maybe you cannot identify that this is a lung tissue from this massive fibrosis. Again here I'll move around. This is another big cyst with the lining epithelium, blood vessels. Again fibrosis, massive fibrosis everywhere in the subpleural areas with these cystic dilatations.